Thank you very much for being interested in the educational module about the pharmaceutical therapy of patients with diabetes. Our module will mainly focus on type 2 diabetes treatment. The first question is, why are we treating high glucose levels? The answer is very simple, because any lowering of glucose reduces the risk of contracting diabetes-associated complications. And this is good. Studies show that already the reduction of HbA1c by only 1% reduces these complications by half. What is the right strategy now in the approach to perform the best available treatment? You will get an answer to this question by studying guidelines and their practical guidance within this module. We will highlight the latest consensus statement from the latest evidence-based guideline and give a short explanation. A clear recommendation from those consensus statements is to increase physical activity on a daily basis, for example by walking 10,000 steps a day, because this significantly improves HbA1c. The guidelines also give clear advice to start diabetes treatment by using metformin as a safe and very effective drug. If the HbA1c is not improving, a second or any additive drug can be prescribed. The strength of a diabetes treatment is to individualize and personalize the choice of drug based on patient's circumstances. Finally, we present the figures from the guideline and go deeper into how to modify choices for different patients. For example, if the patient has a chronic kidney disease, or the patient wants to avoid hypoglycemia, or a financial burden because he has to pay for the medication. At the end of the module, you find an overview about all drugs available in the diabetes sector currently worldwide, and we will highlight the strengths and weaknesses of each of those drugs. Don't forget, the main thing is diabetes self-management education. This is important for every patient. Performing self-monitoring of blood glucose is a key point for a patient to improve its self-management. But the final and the good message is, if the patient becomes physically active, no matter what kind of physical activity, it's the most powerful strategy to improve glycemic conditions. Maybe even to revert type 2 diabetes back to normal. So, if you're honest, in the end, the patient can walk away from diabetes.